Hello everyone, this is Himja. I am pursuing third year BPT at Venkata Padmavati College of Physiotherapy, Tirupati, India. Today I am going to present a paper and the topic is post-operative physiotherapy management in complex and craniofacial deformity. Coming to the introduction, it is a condition where the jaw joint becomes stiff or fused, making it hard to open the mouth. It can happen due to various causes like trauma, infections, arthritis, or sometimes from birth. Symptoms may include patient may feel pain, clicking sounds, or find it hard to chew. Treatment usually includes pain management, physiotherapy, and in some cases surgery. The upcoming slides will show detailed way to manage this condition. Now let's look at the classification of TMJ ankylosis. There are two main types, true ankylosis which happens inside the joint and false ankylosis which happens outside the joint. Depending on the type of tissue, there are three types, fibrous, bony, mixed. Fibrous means which is nothing but fibrous capsule, bony means TMJ bone and mixed. According to the Sahane, based on how the joint movement is limited, it is of four types. Coming to the type 1, joint is badly damaged due to tissue growth and jaw movement is not possible. Type 2, the joint is partly damaged but some parts are still normal. Type 3, the joint and nearby bones are affected and the jawbone is displaced. Type 4, the joint is fully blocked by bone growth between the jaw and skull. Etiology and occurrence. Recent evidence shows TMJ ankylosis has recently decreased due to antibiotic therapy. Coming to the etiological factors, which includes myositis ossificans, which is bone formation in the muscle, osteochondroma, non-cancerous bone growth, rheumatoid arthritis, ankylosing spondylitis, which mainly affects the spine. If disease is progressed, it also affects the TMJ joint. Psoriatic arthritis, type of arthritis which is linked with skin disease called psoriasis. Systemic lupus erythematosus, which is an autoimmune disease. TMJ is also happen after surgeries or radiation therapy. Symptoms and complications. TMJ ankylosis in children can cause serious problem. It affects the jaw growth, make it hard to eat, speak and maintain oral hygiene. The face may look different, sometimes called a bud profile, and become more asymmetric as child grows. Apart from physical issues, it also affects the children's confidence, social life and emotional well-being or depressive symptoms. This slide illustrates the anatomical difference between normal TMJ and dislocated TMJ. Have a look on these images. Treatment of the temporomandibular joint ankylosis. It begins in the mid-19th century. The surgical treatment procedures includes coronoidectomy, arthroplasty with a myofascial flap, and various modern techniques have evolved. Post-surgical care is very important in physiotherapy intervention, which includes we start with first passive exercises. Passive finger stretching exercises. It includes manual finger stretching. Use thumb and index finger to spread upper and lower teeth apart and hold for 2 to 3 seconds. Repeat 20 to 30 times. Later up we add active exercises. Active movements include use of wooden spoons. Patient was instructed to utilize wooden spoons positioned between her incisors, gradually increasing the quantity of the spoon. These steps are essential to restore the joint function and improve quality of the life. Another exercises which is side-to-side jaw movements. Modalities. Usually other helpful treatment includes cold packs and EMS for TMJ muscles. Usually physiotherapy is done under the supervision of first 2 weeks and then the patient can continue at home. They need to do the exercises for at least 6 months. Coming to the conclusion, physiotherapy really helps improve jaw movement and recovery after the surgery. The craniofacial deformities following the surgery, the reviewed studies consistently demonstrate that early imitation of individualized physiotherapy interventions including range of motion exercises, manual therapy, neuromuscular re-education and patient education significantly improve the outcomes. Thank you all for your time and attention throughout my presentation. I hope it was informative and helpful. If you have any questions or need more clarification, feel free to ask. You can also reach out to me at the email provided on the slide. Thank you once again.